Let me ask you something, and I want you to be honest with yourself, even if you can't be honest out loud yet. When you started your GLP-1, did you tell people? Or did you just quietly start losing weight and hope nobody asked questions? Yeah, that's what I thought. Because here's the thing, there is data on this now, real surveys, real numbers. Being a man raised up in this culture and being on this GLP-1 journey for over 2 years, it didn't necessarily surprise me, but it did put numbers behind my thoughts and feelings. Stay with me because this episode isn't just about statistics. It's about why we do this, what it's costing us, and what it says about the box society tries to put men in. I'm RMZ or Charles. This is the weekly shot. Let's get into it. Let's start with the headline numbers because it sets the whole table. A major UK study, the largest of its kind, surveyed over 3,000 people currently using GLP-1 medications. And what they found was striking. 2 out of 3 GLP-1 users are hiding their treatment from friends and family. 2 out of 3. That means if you're sitting in a room with 3 people on Zepbound or Wegovy or Ozempic or Mounjaro, statistically, 2 of them haven't told the people closest to them. And nearly 80% of patients in the same study reported being accused of taking the easy way out. Not strangers on the internet, people in their own lives. Now, here's where it gets interesting because the assumption most people make, including me, honestly, before I dug into this, is that women are bearing the brunt of the stigma. And in terms of actively concealing their medication, women do hide it slightly more, 69% for women versus 53% for men. But there's a twist. A 2025 Kinsey Institute study, nationally representative, 2,000 US adults, looked specifically at fear of being judged or shamed for GLP-1 use, and the numbers broke down like this. 60% of men reported fear of judgment or shame around their GLP-1 use. Men are twice as likely to feel shame about this than women. They're just carrying it quietly, internalizing it, not talking about it. And that right there, that gap between what men feel and what they're willing to say, that is the whole conversation. So why? Why are men carrying more shame around this than women? I've lived it, so I have my own theories, but let's break it down because this isn't random. There are real documented societal forces driving this. Number one, the willpower myth, the most common criticism leveled at GLP-1 users across every study, every survey, every comment section is the same phrase, easy way out. A PMC narrative review on GLP-1 stigma found that both the public and healthcare professionals still widely view these medications as a shortcut. And the underlying assumption is always the same. Real weight loss comes from discipline, from willpower, from grinding. And for men, that narrative cuts deep because we've been conditioned to tie our worth to self sufficiency. Asking for help, whether it's medical or otherwise, can feel like an admission of failure, like you couldn't handle it. And I'll tell you something, I started Zepbound at 315 pounds. I had been trying for years. This wasn't me looking for a shortcut. This was me finally getting a tool that worked. But that first few months, part of me wondered if I deserved to claim the results. That's what this stigma does inside of your head. Number two, the double stigma trap. Here's something one researcher framed brilliantly. People with obesity are first judged for being overweight. Society looks at a larger body and projects laziness, lack of discipline, weakness. You've probably felt that. Then, when you take a medical step to address it, you get judged again. Now you're cheating. Now you didn't earn it. Now you took the easy road. You literally cannot win. You're stigmatized for the disease and stigmatized for treating the disease. And for men who are already socialized to suppress health struggles and just fix it, that double bind is suffocating. Number three, the cultural coding of GLP-1s. Now, let's be real. The cultural conversation around GLP-1s got dominated by a very specific narrative early on. Celebrity women, red carpet transformations, the Ozempic face. The media image of a GLP-1 user became coded as female. And some men, particularly men who spend time in the gym culture or performance spaces, they don't want to be associated with what they perceive as a celebrity weight loss trend. That's partly ego, partly identity, partly just not seeing themselves represented in the story being told, which is exactly why representation in this space matters and why channels like this one exist. Number 4, fear of having your results minimized. This one hits different. You work hard, you change your eating, you get to the gym, you lose 50, 80, 100 pounds, and the first thing someone says, oh, you're on that shot. Like the drug did it, and you just watched. Like the 18 months of choices and consistency and rebuilding your relationship with food just doesn't count. Men who've built their identity around results and performance feel that dismissal viscerally. So they stay quiet. They let people assume it was just diet and exercise. They protect the narrative. Here's what I need you to hear, because this is where it stops being about feelings and starts being about real world consequences. Hiding your GLP-1 use is not a neutral choice, it has costs. A January 2026 analysis in the conversation raised something that doesn't get talked about enough. When people hide their medication use, they're less likely to discuss side effects with the people around them, and in some cases, less likely to even seek medical attention for complications. Think about that. Men are already the demographic less likely to seek medical care proactively. We already push through symptoms. We already delay appointments. Now add a layer of shame around a medication, and you've created a situation where someone might experience a side effect, not tell anyone because they're not supposed to be on the drug in the first place socially, and not go to the doctor. That's dangerous. And there's a broader cost too. When men stay silent about GLP-1 use, it reinforces the idea that this medication is something to be ashamed of. It keeps the stigma alive. Every man who loses 80 pounds and says, I just cleaned up my diet, is unintentionally contributing to a culture where the next guy feels like he can't be honest either. The Kinsey Institute data showed 26% said they would not date someone who uses a GLP-1, and 29% said they were unsure if they would date someone on a GLP-1. That is a combined total of 55% that have some kind of hesitation or reservation towards having a partner on a GLP-1 medication. One of the top 3 reasons, it was the belief that weight loss should come from lifestyle alone. Society is literally saying, we will penalize you socially for treating a chronic disease the way your doctor recommended. That's the environment men are navigating. And if this whole dynamic sounds familiar, it should, because we've been here before. Before GLP-1s, the same conversation played out around bariatric surgery. Same accusations, easy way out, cheating, didn't earn it. And research on bariatric patients consistently showed that stigma persisted even after major weight loss because society wasn't judging the number on the scale. It was judging the method. The PMC review I mentioned specifically draws this parallel. They found that obesity stigma is deeply rooted, so rooted that even significant sustained weight loss doesn't erase it because the judgment was never really about your health. It was about whether you suffered enough to deserve the result. And that framework, you must suffer to deserve it, is one that men have been marinating in their entire lives. Sports culture, work culture, gym culture, no pain, no gain, earn it or it doesn't count. GLP-1s don't fit that framework. And so men either hide that they're using them or they quietly struggle with whether their success counts. It counts, full stop. I started Zepbound on January 12th of 2024. I weighed 315 pounds and I kept it a secret at first. I created separate social media accounts so that I could interact with others that I didn't know and have separation from people I did know. There was a level of shame because I failed. I'm this big tough guy, a former elite athlete, and I couldn't get this done on my own. I failed diets, I failed workouts, I failed bariatric surgeries. Then I said enough of this shame, not because I'm particularly brave. Honestly, starting this channel was a bit terrifying, but because I looked around and I didn't see men who looked like me with a history like mine talking about this openly. And I knew that silence was costing people something. 120 pounds later, I can tell you the medication gave me a tool. I did the work. Both things are true, they're not in conflict. And here's what I want every man watching this to hear: seeking medical treatment for a chronic condition is not weakness, it's the opposite. It's taking your health seriously enough to use every tool available. It's what we tell our fathers, our brothers, our sons to do without a second thought. The shame that society puts on this, that's not yours to carry. That belongs to a culture that still hasn't caught up to the science. So here's my question for the comments. And I genuinely want to know, when you started your GLP-1 journey, did you tell people? Or are you still keeping it a secret? And if so, what's the fear? Drop it below, no judgment. This is literally what this channel exists for. If this episode resonated with you, share it, because I promise you there's a man in your life who needed to hear this and isn't going to find it anywhere else. Hit subscribe if you're new, and I'll see you on the next weekly shot. The material reference today is linked down in the description. I'm RMZ. Take your shot.